Hello, my name is Stephanie Corey, and I am a master's student in epidemiology at the University of Pittsburgh. And my project is evaluating preventative care measures for the human papillomavirus and related cancers in lesbian, gay, bisexual, transgender, and queer or questioning individuals in Allegheny County. So first, I'm just going to give a little background about HPV. HPV is the most common sexually transmitted infection in the United States. The CDC right now estimates that approximately 79 million Americans are currently infected. And while many HPV infections are asymptomatic and harmless, there are a few strains that, if left untreated and undiagnosed, it can cause devastating consequences. So HPV has been linked to various forms of cancer, including almost all cases of cervical cancer and about 95% of anal cancer. So those are the two cancers that I focused on, but they have, it's also been linked to the cancers listed below. Right now, current recommendations, they've changed over the recent years, but current are about both men and women, or boys and girls at about 11 or 12 should be receiving the HPV vaccine. And it's been proven to be effective in preventing HPV infection, as well as the screening preventions have also been proven to increase early detection and leads to better health outcomes. So some background on the LGBTQ community. It's estimated about 4% of the population, although to narrow down that number has been very difficult. That is likely an underestimation, but as time goes on and more people are feeling comfortable to identify as such, it's likely to grow. So just some there are current and many gaps, I would say, in the literature regarding LGBT in general, but especially in the cancer field. So some current barriers to care would be perceived or actual discrimination, difficulty affording health insurance, limited available resources, and not finding inclusive and trained professionals that are getting the right competencies with LGBTQ health issues. So for gay and bisexual men, they have an increased risk for contracting STIs, and this risk can be attributed to either a higher number of sexual partners, riskier sexual behavior, and a greater co-occurrence of other STIs. This ultimately results in a higher risk for gay and bisexual men to develop anal cancer compared to heterosexual men, and another component which my project does not get into, is just the increased risk for HIV, and HIV positive men have a much greater chance of developing anal cancer compared to HIV negative men. As for the lesbian and bisexual women, previous research has shown that they are less likely to receive even at least one of the HPV vaccine shots, and from that study that I'm citing, about 25% of those lesbian and bisexual women had some form of cervical abnormality because of the HPV infection. And additional studies have shown that lesbian and bisexual women are less likely to partake in routine cancer screenings compared to heterosexual women. For the transgender individuals, there is almost no data related to cancer either needs or the burden of cancer. So I hypothesize that given that transgender individuals are at higher risk for contracting HIV and also higher risk of other co-occurrences of STIs, I'm just hypothesizing that they are also at a unique risk. All right, so this brings me a little bit to my study site. My study site was Allegheny County. That, for those of you that aren't from Pennsylvania, it's about Pittsburgh and Pittsburgh's greater area. There's about 1.3 million people in that area, and it's the second most populous county in Pennsylvania. Previous population surveys usually estimate that roughly 36,000 to 49,000, again, that's a very loose number, identify as LGBT as adults in that area. And I believe since Allegheny County and Pittsburgh in general has such a great reputation for outstanding research and healthcare, I wanted to make sure that the LGBTQ individuals there were receiving the same sorts of preventative healthcare that the heterosexual and cisgender individuals were receiving. Okay, So in order to assess these preventative measures within the LGBT community, I analyzed the 2015 and 2016 health survey from the Allegheny County Health Department. The survey was modeled after the BRFSS and asked one question each about sexual orientation and one about gender identity. But before acquiring the data, I wanted to meet with some local professionals to see what kind of current recommendations they're sticking to, since this is something that has been ever-changing since the HPV vaccine has come out, as well as other professionals who specifically work with the LGBTQ community within the Allegheny County. So I first met with Dr. Yuan. He is the leader of Cancer Epi and Prevention Program at UPMC, and UPMC is pretty much the main healthcare provider in Pennsylvania, but especially in Allegheny County. And while he didn't have so much experience working with the LGBT, he was saying how difficult it is to even keep these professionals on track with the changing vaccine recommendations. So he also mentioned how it's starting to come about in research that there are greater links to HPV in head and neck cancers, but that is something that unless you would suspect that you have head or neck cancer, they're not going to do a screening. But I think given some of the research we have, especially with gay and bisexual men, I think it's important to keep the LGBTQ in that sort of conversation when more things are coming out about that. I also met with Dr. Lynn Robertson. She's the Associate Director of Health Equity, Education, and Advocacy, and her primary interest is increasing access to HPV vaccines in rural locations, and she also works with the LGBTQ, so that was great information to hear with trying to access hard-to-reach populations as well as disseminating results to healthcare providers in those areas. And lastly, I heavily relied on Dr. Robert Coulter. He is a postdoctoral researcher in LGBTQ health, and he answered many of my questions regarding the analysis of LGBTQ, which I'll get into very shortly. And so this brings me to my actual methods, and while I knew I wanted to create logistic regression models while controlling for various social and environmental factors, that proved to be a challenging one. So just to give you a better idea, I broke it down into both sexual orientation and gender. My mentor and I, Dr. Catherine Haggerty, we decided that since the HPV vaccine was first targeted mostly towards women, that I was going to use the straight women as the referent group as well as the straight men as the men's referent group. The sexual orientation categories, as you can see, are straight, gay or lesbian, and bisexual, and other. And while other can mean many different things, I wanted to keep them included because I think it's important to show that you have to give those other people some sort of voice, and even if you can't cohesively say that they're a group, I still wanted to include them as further evidence that you need to be, I guess, more inclusive when you're looking at sexual and gender identities. And for the gender identities, it included cisgender female, cisgender male, trans men, trans women, and gender nonconforming. And while it would have been ideal to be able to keep those three categories separate, I ultimately had to collapse them into one group of 36. So ultimately moving forward, I would have liked to have seen that would be a bigger number, but like I said, it's a very hard to reach population, and so I had to go with what I had. So after identifying sexual and gender identity, I wanted to look at our outcomes. So that would have been ever receiving the HPV vaccine, the number of HPV vaccine received, ever having a pap smear, an HPV test, or a rectal exam, and when was your most recent pap smear, HPV test, or rectal exam. I collapsed those, the frequency categories into recommendations by the American Cancer Society. So it was either that you received it within the recommended time or you did not receive it then. And I ran logistic regression models, first unadjusted, and then also I adjusted for age, race and ethnicity, education, marital status, income, and then the history of the hysterectomy. That one was a little tricky too for the pap smear because given whether you were having a full or a partial hysterectomy would then indicate if you still needed a pap smear or not. So if you really wanted to assess if the women who needed pap smears were getting them, then you would have to have more information. So, of course, I ran many models, but in order not to bore you, I put only the significant results up. If they're not mentioned here, it's either they were not significant or they were severely underpowered to the point where it wouldn't have been an accurate result anyway. But here is showing the gender identity. So, not surprisingly, I guess this was what I hypothesized, that the cis men and the transgender individuals were at lower odds of receiving the HPV vaccine. This HPV vaccine is if you've ever received one shot or not, yes or no. Also, the trans category for the number of the HPV was too low to include, but the cis men were less likely to complete the actual 3 or more recommended shots that they would have needed. And for the pap smears, the transgender individuals were at lower odds of having ever received a pap smear. And for the HPV test, although the transgender result is not significant, I would say it's pretty close. And I think with the greater sample size, you might be able to establish if that result is significant or not. So these are the results for the sexual orientation. I just want to let you know these are all the women. The men were only looking at the HPV vaccine, number of HPV vaccine, and also the rectal exams. But for the other screening questions, they pertained only to the women. So like I said, the straight women were the reference category, and the other women for both the pap smear and the HPV test were significantly at lower odds to have received either of those screening procedures, and the bisexual women were at lower odds to having received the pap smear in the recommended time. So for future analysis, the survey actually broke Allegheny County down into 13 districts. What I would like to do is identify if there are certain clusters of queer individuals that are living in probably more rural locations, and if certain clusters would benefit then from including more LGBT either screening or just even education to those individuals. My learning experiences, definitely collaborating with different professionals. What I found is, especially dealing with something with LGBTQ, it's not I guess, sometimes widely known what are all the unique needs and characteristics of this population. So finding other professionals that are either experienced in that was rather difficult, but the ones that are experienced have great advice. And I really, I guess, realized how much of a team it had to be in order for real progress to be made. Definitely also understanding a large data set. It was pretty overwhelming at first, but once we broke it down into smaller chunks, it became more manageable. And I think I also gained methods to how to bridge the gaps in the future. And it really did reaffirm my desire to pursue research in LGBT cancer. So the strengths, this was a large sample size of LGBTQ. It's a hard to reach population, and so actually going out and finding that many queer individuals would have taken a lot of time and resources. And I think that even though the preliminary data was small, I think it's still beneficial because it gives you some sort of highlighted points that you can start with. And I think the inclusion starts to break down barriers. Again, it's an issue that's just starting to kind of get woven into a lot of aspects of the medical field. And so I think asking these questions, even in a normal randomized telephone survey, will then get other people comfortable talking about them, will get the queer individuals comfortable asking these questions, and also get the medical professionals comfortable with treating these patients. Limitations, it was a telephone survey, and given the sensitivity of sexual orientation and gender identity, we may have people that don't feel comfortable disclosing that information. And this survey was ultimately not designed to assess the needs of LGBTQ individuals, so that was a big drawback. It didn't ask about sex assigned at birth, so with the transgender individuals, even though they equated sex and gender, you necessarily couldn't analyze if they needed certain screening procedures based on their biological sex. So if you really wanted to assess those needs, you would have to ask more in-depth questions, which I would say probably isn't what this survey obviously was intended to do, but probably also not the place to do that. And the other category, like I said, it's hard to really draw conclusions based on that category because different identities within that category are very different in terms of behavior and attitudes. So I think there needs to be at least an option to explain rather than just other. The effect size, some of the small sample sizes resulted in underpowered statistics, and categorical data, they only had categorical, so it was really hard to then reformat variables since there was no continuous data to work with. Ideas for future students. This health survey also had other screening procedures that were not related to HPV, such as mammograms and colonoscopies. So they could definitely work with that. But like I said, again, there's a ton of research that still needs to be done. I think one is working with the LGBTQ community to provide specific education so they know their risks, as well as assessing the attitudes they have and the barriers they currently face. Other is with the professional and medical side of it. They have to be more inclusive and appropriate. I've heard and seen a lot from queer individuals that say, well, all they have to do is ask, and I will tell them. And that's not the case for everyone, but as I feel that a lot of these LGBTQ individuals just feel like their needs need to be addressed and need to be included, and then that way we can start to assess their needs. My future plans, I would ultimately like to obtain a PhD in cancer epidemiology with an LGBTQ focus. And I kind of want to be in that bridging the gap sort of space, also working with LGBTQ individuals, but then providing comprehensive training to medical professionals in an area that is a little behind. Any questions?
When was the vaccine first available?
So,
I'm just thinking that the older individuals in your population were never eligible to get it since it's targeted at 11 to 13 years old for the,
Right, and so when I was looking at age, it was between 18 and 25, and I want to say there were maybe 3 or 4 individuals outside of that age category that had received the HPV vaccine, but from my recollection, I want to say it was available around 2004, but that was just targeted towards women. Don't quote me on that date, but it was around the early 2000s, and then the men came later after that.
Yeah, I think you're right.
Mm-hmm.
That describes the baseline characteristics of your population to see if the differences that you see are based on the differences in characteristics compared to screening rates. That's one question. The second question is, you said that there are other screening questions. I was wondering if you thought of including just a general screening guidelines in terms of assessing if people are more likely to have screening than they're more likely to have HPV. So if they have other indicators of seeking health care.
So to answer your first question, yes. I don't have it included here, but I also potentially looked at other confounders such as health insurance, if they had a routine doctor that they could go to. For the most part, it was significantly different. They had, for the most part, much worse, I guess, access and along those lines. With the cancer question, there was only if you've ever been diagnosed with skin cancer, and then how often you're getting your colonoscopy and your mammograms. So I do think that that's a good place to start, but I haven't got into that yet. Okay, thank you.